Hi, Doc. This is Troy.
Troy!
Hi, are you okay?
No, I'm pissed off.
I can imagine. Well, I'm doing a story now about your comments from last night and Dr. Shea's comments that he gave me today and Dr. Lombard's post as well. But so Johnny was telling me about the situation that you're in, and and we understand that it's something that you don't mind being made public. I'm just wondering, it'll cause a panic, I think. You know what I mean? So can you tell me
I
about your
think
situation?
people are panicked already, so
Okay.
let's reassure them that I'm not panicking. I'm pissed off.
Okay. Okay. Is it okay?
Because
Is this on the record?
yes,
Okay. Okay. Go ahead, sir.
also, I don't mind getting sick. I mean, we knew we were going to get sick when we started, you know, helping out the hospital, and of course, all the people that are worried about being sick and maybe have legitimate reason to be infected, we're going to come here. I mean, that's why we protect ourselves, and that's why our goal is to be cautious and everybody wears their PPEs. But these things are happening everywhere, so doctors and nurses are getting infected. Most of them don't die, and I don't plan to die. But what's really pissing me off is my staff kicked me out of my own clinic because that's
Well,
the protocol.
well.
So I
So
can't work.
if you test positive, does this mean that you're down for the count for at least 14 days?
Yeah, I mean, we need to make sure that I don't spread it around, right? So, of course, I'm worried about my family and I'm worried about everybody else who might, have been in contact with me. But I don't even have symptoms. I mean, I was starting to feel lousy when I came in to work today, and people saw it and they slammed me up against the wall, shoved the thing up in my nose, and said, "Get out,"
Got it.
because they're not going to let people that are not looking good come into the clinic and touch other people. So I guess I don't look good to them.
Are they? Has public health at least started the contact tracing with you?
Public health hasn't started the contact tracing with Father San Nicolas, who was also shut down yesterday because he went to GMH to do sacraments of the sick, anointing of the sick. I don't even know if he actually had a chance to anoint any sick people, but he just texted me this morning that he wants me to do something about the fact that he's in quarantine. The vicar of the Archdiocese is in quarantine.
And so, and they haven't even started the
And
contact tracing with him?
I'm the vicar of AMC.
Yes, you are. But I think right now you're like the vicar emeritus for now, temporarily.
Or what do you call it? Defunto.
No. You're not different too. Doc, man, okay. And I'm sorry you're having to go through this, and your patients are gonna have to do without you for some
Well,
time.
that's the thing. We shut down, though. I mean, we're not, for the most part. In fact, that's why I'm pissed off because I'm trying my best to manage my patients' needs, telephonically. In fact, we have a really cool setup in the room I'm in where we're about to launch a really sophisticated telemedicine program to try to keep people, up to date. And a lot of people have phones where we can do stuff. So it's going to be a George Jetson thing. This needed to happen anyway.
Okay.
But what's changed is a lot of the payers are agreeing that this is the way to go. I mean, before, if we did it, we never got paid for it, right? We were doing all this work and keeping people out of the clinic, but nobody cared. And, it was great, but I mean, you can't waste all your time doing something you don't get paid for because we have staff, right? And in fact, we're out of hand sanitizer. Well, we still have hand sanitizer, but we're out of our protective gear to do the swab. So we were going to need to shut down anyway. We're having a big argument in our clinic about how long can we stay open, and this kind of concludes the argument because we're not going to stay open if people are going to get turn positive. So if I turn positive, yeah. Shit's hitting the fan. But shit's been hitting the fan for the last 5 days, so,
Well, let's talk about that. Are you? Because now you're one practical
Hey,
case
are
of
we
it.
on the radio, or is this live?
It's not live. It's not live, but I am recording.
Yeah, okay. I mean,
Yeah.
I don't mind. I mean, because I don't want to waste this. This is going to get good. You're going to
Yeah.
get some juicy juicy stuff.
Well, we were hoping that we wouldn't get juicy stuff out of this whole emergency, but it seems to have been botched by the government so poorly that we are
And
where
it's
we
going
are
to make a
now.
great movie. It's going to make a great documentary one day.
Well, they
We should call Michael Ward to come, and he'll make it funny and thought-provoking. But you can do that too. You guys have been putting out some good montages.
Okay.
We have some things that we'd like to work with you. So now, since I'm basically in jail, just like all my brothers and sisters over at the Wyndham Garden, right? So
Yeah.
I'm doing a shout out through you to my brothers and sisters over at the Wyndham and
Days
Santa
in.
Fe and Days in. Solidarity, man.
Thanks.
Free Nelson Mandela.
I'm
Free
sure
Nelson Mandela.
I'm sure they will appreciate that very much.
Free Nelson Mandela. Remember that song?
No, I don't. Is it
Third
from?
World. It's Third World.
Oh, okay.
Can you play that in the background when we're doing our interview?
As long as it's not copyrighted. Doc,
What?
are
Are you serious? In a time of pandemic.
oh,
the
because
copyright things are gonna-
we'll get in Facebook jail for using copyright.
Free Nelson Mandela. Okay, well, just sing it then.
Doc,
Joe Guam. Let's have Joe Guam sing it.
if I like his voice, Doc, if this is happening with you and considering the allegations that the protocols are not so tight or not even being followed at, let's say, Guam Memorial Hospital or other healthcare providers, are you concerned that other doctors and healthcare providers are going to go down in this kind of way?
It's happening in excellent healthcare systems around the nation, so I can't see why GMH would be spared. I mean, we don't want it to happen. I hope we're somehow immune to that, but it's unlikely, and we do have concern for all our nurses and doctors and patients and families at GMH. So I sincerely hope that we avoid that. But as you know, the medical city of the Philippines has 150 nurses and doctors in quarantine.
Wow.
As of last night.
The governor said that we have 50 respirators. Do you know that to be true?
We have perhaps 50 ventilators that are existent, but whether they're functional is highly doubtful.
Okay.
And 50 is a good number. Hopefully, we never need to use it, and I don't plan on needing it.
Okay.
My goal is to watch the sunrise and the sunset for the next 14 days and breathe clean Guam air. That's my ventilator, and I don't need to be mechanically ventilated to appreciate that. So yeah, there are some pretty dire scenarios that could occur as a result of people getting severely sick. So I think people staying home, practicing all due safety is wise. I'm not sure that a lot of these draconian measures would be necessary if public health had an excellent, aggressive, and as hyper-vigilant system as my American Medical Center Nazi nurses have. Who threw me up against the wall and then had a doctor come and just shove that thing up my nose and then send me out of my own clinic and told me not to come back. So if public health, Guam Public Health would be as aggressive and as vigilant as the American Medical Center nurses, we could prevent a lot of people from having to worry, and we could prevent a lot of people from needing to be unproductive, because this is unsustainable what we're doing. I mean, how are people going to eat? How are we going to take care of ourselves? Who's going to take the garbage out, right? So a lot of really unmet needs, unanswered questions, which now all of us get to sit around and ponder, because apparently we can't go outside and we won't be distracted except for phone calls from Kandit News. So thank you very much for
no problem.
keeping me from suffering from cabin fever.
No
We're going to have
problem.
Kandit fever instead of cabin fever.
Doc, are you
I want to be
concerned?
free. Let me free.
Are you concerned that
I committed no crime. I will serve no time.
Are you concerned that our state epidemiologist is a sociologist and not an epidemiologist making decisions?
I wouldn't care if she was a flight attendant. I need functionality, and we don't have it. And this is not to hurt anybody's egos. If we were the New England Patriots, and even if you were Tom Brady, if you were throwing interceptions and fumbling the ball, if we were losing by 14 going into the fourth quarter, I'd bring somebody. I'd make somebody else be quarterback because you're not doing it. So I'd get Julian Edelman to be our quarterback, and we'd win.
So the function of this program, or the management of this program, is sorely lacking.
I mean, they're trying. It's just not working. I mean, we now have the highest penetrance of COVID-19 infections in the entire United States and possibly the world, at least in the last 5 to 7 days. And we're pretty certain that the lab is not running enough tests. I mean, they have tests. They're being very stingy with it. That's our whole criticism. I mean, we know we have a big problem and we need to contain it. And so, I mean, I'm sitting here waiting to see if my results will be back. You know, it takes 4 hours to run the test, and I know the technicians they're bleeding. I mean, they're running, they're putting themselves at risk. They're handling very dangerous, toxic material in order to run these tests. So they have to be careful, and we don't want them to get sick. There's really only like 2 people on the island running this whole system. They've run 100 tests. Apparently, that's more tests than have been run in Hawaii over the same period of time. So Hawaii's doing the same thing. They're holding back on testing in the hopes that they won't have to acknowledge that they have a problem. So both of them are like drug addicts. They're addicted to tourist money, and instead of worrying about your children, your family, your mom, they're holding back on testing, hoping that these positives won't come back. But I guess the lab technicians are too honest and too competent. We're getting lots of positives both here and in Hawaii. But I think in this case, we're beating Hawaii because, I mean, we were at an astounding 1 out of 4 positive. For every 4 tests, we had 1 test go positive. That's crazy bad.
Yeah.
And, now, yesterday, astonishingly, only 2 positives came back out of the batch of, I think, 19. So now we're at 14%. In terms of penetrance. That's still the highest in the nation, and we're pretty sure that was wrong because they didn't run all the tests, and I was exposed to at least 6 people who were obviously, at least to me, had high index of suspicion for being infected. So I told them to go into quarantine until we can get the test results back, and we haven't heard anything from public health. I was afraid that this would happen on Saturday when I'm sure they want to go to Kmart and go shopping or, do something sexy. There's a good likelihood that they're not going to run tests until Monday.
Wow.
I don't know what they plan to do. In fact, I would hope an intrepid reporter like you could find out. I mean, this is terrible, and I'm not going to mince your words. We have nurses and doctors at GMH who should have been tested yesterday. They should have been tested, and the moment that we found out there was a breach, everything should have been about protecting the staff and making sure they weren't going to go home to infect their children. But in reality, testing too quickly means you're going to get a false sense of security because it could develop. Usually you're going to have enough virus in your nose to have a true test after the virus has had a chance to really eat you up, and that might take about 72 hours. We don't know exactly how long, but we need to do more testing, and we need to do repeat testing. Just because you're negative once doesn't mean you won't be negative tomorrow, especially if you keep getting exposed. So, at any rate, I'm trying not to sound panicked. I am not afraid. I mean, again, I have a very good immune system. I eat Kettle at every party that's been left out for like 6 hours, and I don't die.
Doc, I want to talk about this testing thing. That there's a huge gap in the testing criteria that's unique to Guam, and that is, if I come to you with these symptoms and I have a fever of 100 degrees or more, and you ask me whether I've been exposed to a confirmed COVID-19 patient, how am I supposed to know whether I was exposed to a confirmed COVID-19 patient?
It's a stupid question at this point in time. If you come in with a fever of 104, if you have a cough, and if I run a flu test and it's negative, or even if it's positive, but we know that in the area there's been COVID-19, I want to test you. We want to test as many people as possible.
Yeah.
I mean, we want to test people that are asymptomatic. I mean, but we understand that there's been a stinginess about testing because we don't have the luxury of abundance. But I think that that's an artificial problem. I'm gonna accuse Guam Public Health is not trying hard enough. I ordered some underarm deodorant from Amazon.com on Wednesday or Tuesday, and I got it on Friday. How the hell long does it take for us to get kids from Atlanta? I mean, this is not rocket science, right?
Yeah.
I mean, they could have had the Pony Express send it 2 weeks ago, and it probably would be here already. But, that's the thing. You can't handle the truth, apparently. We can't handle the truth of how bad it is. And somebody thinks that if we say we're COVID-19, all the Koreans are going to run over here. Well, not if you're lying.
Yeah.
Not if it turns out it's not true. And now you're painting this really obscene picture of us being the most infected COVID-19 community in the world. Now, this is the bright part, because I'm not panicking. You know what really helps me? Is no one's died yet.
Yeah.
At least officially. Unfortunately, that's about to change in the next 4 to 6 days, maybe 4 to 6 hours, because you don't call the priest to the ICU usually because it's a happy occasion. You know what I'm saying?
Yeah. Yeah.
And so we don't expect that we're going to get out of this without fatalities. So we have a lot of cases. We have several people dying. That's not too good for tourism.
Yeah.
So how about we, instead of trying to hide the problem, right?
Mm-hmm.
Instead of hide the dead bodies, let's develop a plan where we minimize the number of dead bodies and show that we can competently deal with this problem, which honestly Guam was built to solve. Coronavirus comes to Guam to die, and so we just need to make it happen. And I think anybody who gets a positive result, gets infected, you have every right to be concerned. In fact, I sure as hell hope all those people that went home are getting some sort of counseling and follow up by a public health doctor. I'm pretty sure it ain't happening, because I haven't gotten a call from any public health doctors about any of the number of patients that I've been concerned about. I've been the one having to call them, and they generally try to avoid my phone calls. It has been a terrible experience working with public health doctors, except for Dr. Pete Hancock. And although she's not a doctor, the director, Miss Linda DeNorsi, they're stellar. They're stars. I mean, but you can have a really bad team with a bunch of really good players, like what's his name? Peyton Manning's dad used to play on the New Orleans Saints. They were terrible, but he was a great player.
Oh, okay.
Archie Manning.
Cool. Well, Doc, thank you so much for your time, and please do whatever it's possible to stay safe so I can see you at church again.
Gin and tonic. That's my prescription. Tonic water has quinine. You do the math.
Oh, okay. I'll
take 5 gallons a day of tonic water in order to.
Well, I got some of that in my fridge along with some vodka.
You're a lucky man, because I'm pretty sure it's going to be in short supply.
Thanks, Doc. Thank you so much for your time.